My name is Robert Hudson. Welcome to another Pet Radio Show podcast. My guest today is Dr. Albert Ahn, a respected veterinary advisor to the animal health industry and spokesperson for OHS REMS, the creators of a proprietary broad-active composition that helps build lean muscle. Welcome, Dr. Ahn.
Thank you so much for having me, Mr. Hudson.
Tell us what this proprietary broad-active composition is, just briefly.
Sure. So the active ingredient is called fortitropin, and it is an all-natural supplement that is derived from fertilized chicken eggs. So again, the name is fortitropin, and it has very powerful abilities to help muscles grow.
Well, we're going to talk a little bit more about that later here, but what I wanted to do first was kind of tell you a little bit about my dog, Buster Boy, and what his current state is and what you think I might do to better his quality of life. Buster Boy's 12 years old. He's a 22-pound mix of beagle, pug, and who knows what else. And he's here's what I've noticed. He's slowed down. He has diminished hearing and eyesight. He eats slower, he tires out quicker, and he sleeps a lot more. Is this all normal, and what should I be doing to make him more comfortable and a better quality of life?
These are all great questions that you ask, and we see in many of our older patients, and certainly Buster Boy would fall into that category, many of them will start to slow down, and as they continue to get older, they can start to get a reduction in their hearing and also their vision, and they might even eat a little bit slower and get more tired more quickly, and as a result, they might need to sleep more. So what are some things you can do? Well, I always tell folks that getting regular veterinary checkups is very important because there may be certain conditions or diseases that your veterinarian can identify and provide some specific treatments for. In terms of diminished hearing and diminished eyesight, there are special tests that can be done, and quite possibly they may need to pursue certain procedures to try to make changes, in particular to the eye, to help improve eyesight. Eating slower?
It is.
Go ahead.
It is possible to improve their eyesight even after it's noticeably diminished. I mean, they can't just they can't regain their full sight, can they?
So, if their eyesight has been diminished because they have cataracts, for example, which you can see in older dogs, we actually have the ability to replace the lenses in dogs with brand new lenses, and their eyesight will improve significantly as a result of that procedure. So, sure, that's something that can be done.
Wow. Okay.
Yeah.
Well, I've noticed it in the sense that for years, when our favorite game was playing fetch, wherever we were outside, if I threw a ball or a rock or a stick, he would go tearing after it, however far away it was, it seemed, and then bring it back to me and sit there until I threw it again. He still loves to play this game, but when I throw it, if I don't throw it directly in front of him, if it's off to the right or to the left, he doesn't see where it went, and then he spends 10 minutes running around circles, sniffing the ground, trying to find it. Or at dusk or dawn, where the light is much lower, he loses sight of it. Once it's thrown out, he's not sure where it went. Is that something that can be improved on?
Quite possibly. As I'd mentioned, if this is because he has started to develop cataracts in his eyes, a special doctor can take a look at the eyes, and many of them are trained to be able to do cataract surgery where they remove the cataract lens and can replace it with a brand new clear lens. So in that instance, it could certainly help Buster Boy with his vision.
2 or 3 years ago, I switched his diet to a poultry and grain-free kibble. Because at that point he started having excessive scratching and biting, and which he hadn't had that problem when he was younger and would eat just about anything. But because a poultry and grain-free kibble is, I guess, the most common food allergy, that was what I tried first, and it seemed to work. He cut down quite a bit on his scratching and biting and hair loss and so forth. Now I'm adding water to his kibble to soften it up and make it easier to chew for him. Should I change his diet off of kibble now to a softer food or something? Is there something more appropriate, or is what I'm doing just fine?
You can certainly try to soften his food. You can also look at switching over to a softer food. But one of the things I would recommend is getting a good oral examination, because it could be that Buster Boy's trying to tell you that he may have some gum disease, which is causing him discomfort when he is chewing. So if he has some gum disease, and in some areas it may be significant, it could be causing him pain when he's chewing really hard food. So that could be potentially treated by getting a dental cleaning, and they may also have to do some other procedures just to help reverse any gum disease that may have developed.
He loves chewing on bones still, though. Is that a smart idea to allow him to chew on hard bones?
As long as you're supervising the bone chewing, in most instances it is okay. I would say that if you have a new puppy, which he is not, you just want to be very careful that they don't swallow it. But I always tell people who have their dogs chewing bones just to be cognizant that if the bone is getting a little bit small after a lot of chewing, it can become a swallowing or choking hazard. And if that's the case, it's a good idea to replace it with a brand new large chew bone.
All right. Now, how important is exercise at this stage in his life?
You bring up an excellent point, Mr. Hudson, that as dogs age like we do, they do tend to lose muscle mass, which is a normal aging change. And the most important thing that you can do is get regular exercise. And if you notice that they're slowing down, if you notice that they're losing muscle mass, you can use a supplement that contains fortotropin, because it has been scientifically proven to reverse muscle loss. It will actually help to rebuild lost muscle, particularly in older dogs. And what many clients will report is that their dogs are becoming more active, they're more easily able to go up and down stairs, they're more playful, they can go for longer walks, and we all know that exercise is excellent for both the dog and their pet parent.
How do I know how to gauge how much exercise I should give him, without overworking him or put him in a vulnerable spot where he could get injured or something? How do I gauge how much is too much exercise?
Great question. By working with your regular veterinarian, they can determine for you or help design an exercise program for your dog so that, to your point, you don't overdo it. Just like people can overdo it in the gym, you raise a good point. It's possible to over-exercise your dog, and we know that the best way of providing exercise is in the right amount each week, and as I'd mentioned earlier, particularly for those dogs that have lost muscle mass, by supplementing them with fortotropin, you will help them regain some of that lost muscle.
Does fortotropin have any side effects? I mean, it's not like people taking steroids or something, is it?
It is an all-natural supplement. It does not have any side effects that would be deleterious for your dog. And just like any other natural supplement out there, it can have a number of excellent benefits, particularly for the muscles. of your dog.
Hmm.
We find that particularly for dogs that may have had one of their legs immobilized because they had a major surgery, such as a cruciate ligament surgery, or they had a fractured leg that had to be immobilized, they lose a lot of muscle in that immobilized limb. And when you give them the Fortotropin, it helps to regrow and rebuild all of that lost muscle, thereby allowing them to make a more full recovery from the immobilization.
Now, is this buildup of muscle mass permanent?
Well, it's permanent to the extent that you continue with the exercise program. And so it's very important that when you're using the Fortotropin, if you want to get the best results, you also want to make sure that you've got exercise as part of the daily routine as well. That's going to give you your best results.
Well, what role does mental stimulation play in all of this?
So mental health in dogs is very important, as it is in people, and we recommend that dogs get plenty of active mental stimulation every day because it will help keep their brains more alert and also help contribute to a better quality of life for them.
Now, do dogs develop the same type of breakdown of their mental faculties as people do as they get older? I mean, can a dog experience senility or?
Yes, they, as they age, can start to develop cognitive dysfunction, and it's important to work with your veterinarian to recognize that cognitive dysfunction earlier in the process so that you can make adjustments to accommodating your dog's progressive cognitive dysfunction.
Is it manageable?
It is manageable as long as you are able to make some changes to the home environment and as long as you maintain regular and active dialogue with your veterinarian, because there are a number of techniques that can be used to try to help these older patients that have started to have cognitive decline.
Well, I've noticed when I let Buster outside to do his business, oftentimes he'll go outside and he'll just stand in one spot, seemingly staring into outer space for 5 or 10 minutes before he walks off to his potty place. So is that a sign that something may be going on, you think?
It's possible. You know, it's possible that it could be something cognitively related. Alternatively, it could be something going on with his urinary tract as well. So it would be a good idea to have your veterinarian check him out and see if everything looks good and everything is normal.
Okay. Well, are there any basic mental stimulation exercises or activities that that you like or that you would recommend that people try with their dog?
Some of the things that I like are food puzzles, for example. You can get some of those toys where you can hide the treat inside of a toy, and they have to work at trying to solve or follow the puzzle to where the food is located. So that's a form of mental stimulation that I find to be very, very popular with my pet parents.
I see. Okay.
I recommend going to your veterinarian at least twice a year because your veterinarian is going to be a great resource of information and will be able to make specific recommendations on any findings that they may find during the physical exam process.
And where do people go to find more information about OHS REMS muscle building product? Do I got that right?
Yes, it's a little bit of a tongue twister, but it's called Fortotropin.
Fortotropin.
And exactly. And you can find more information on it if you go to the website. The name of the company is called OHS REMS. Their website will have all kinds of information for pet parents who are interested in learning more about the product. That website, just for your information, is called myosrems.com. That's myosrems.com.
And I presume that the product is acquired through your veterinarian. Is that right? It's not. You can't just go to PetSmart and buy it or something, right?
So it is available through your veterinarian as a veterinary strength product. So it is distributed by veterinarians as a veterinary strength product. There is a regular strength product that is also available, but the veterinary strength one has been fortified to help those patients that need the extra muscle building boost.
I see. All right. Well, thank you so much for coming on today and sharing this information with us.
Well, thank you so much for having me, Mr. Hudson. It's been a pleasure.